Hello my dear friends, I'm Dr. Vaishali Bharambe. I've been teaching anatomy for more than 25 years and I love it. Today we're going to talk about skeleton of foot, the bones of foot. Okay, so this is what we're going to talk about. Come, it's going to be great fun. I hope you enjoy it as much as I do. So one request to all of you, please always sit with an articulated foot in your hand. So it can be real bones like these, it can be artificial bones, no problem. But always sit with a set of bones in your hand. Another thing, if possible, keep the tibia fibula also so that you can articulate to understand the formation of the ankle joint. Right? Okay, let's begin. First, I want you to see how to draw the bones. See, sometimes we just don't remember all these bones. So how are we going to remember them? Come, take a look. So here on the screen, you can see the bones of foot, right? So how do you remember them and how do you draw them? If possible, take a pen and paper and quickly draw. Over the calcaneus, write C. Over the talus, write T. In front of it, write N and C for navicular and cuboid. In front of navicular, MIL, medial cuneiform, intermediate cuneiform, lateral cuneiform. In front of this, first metatarsal and phalanges, second metatarsal and 3 phalanges, third, fourth, fifth metatarsals and phalanges. There you have a foot. If you can just practice this a couple of times, you will find that you have the bones of foot in your hand at all times. Okay? Right. So, which bones form the skeleton of foot? Read, identify, memorize. Talus calcaneus proximally. Navicular cuboid just beyond it. Medial cuneiform, intermediate cuneiform, lateral cuneiform in front of that. First metatarsals, second to fifth metatarsals and the phalanges. These are all the bones that form your foot. Now, more importantly, palpate as many of these as possible on your own foot. See, it's very easy to think that this is somebody else's. No, it's not somebody else's, it's yours. It's there in your feet. Just bend down, feel the calcaneus. You can easily feel your cuboid, your navicular tuberosity, the metatarsals, obviously, you can feel them. Please palpate, practice, understand that this is you. Okay, then maybe you will find understanding these classes way easier. Right. So, the trajectory of the lecture. I'll explain the tarsals in brief. I'll discuss individual tarsals with you as much as required for a learner. Not extreme details, because I believe that any anatomist who wants to know the details should feel free to call me and we can discuss it. Okay, but I have to make my lecture meet the requirement of most of you. There will be a brief discussion of metatarsals, comparing them with the metacarpals and just a touch of phalanges. So, I just want to show you the concept of axis of foot once. See, just imagine that you have a line which is passing through your second toe and calcaneus as it is shown here on the screen. Okay, then understand that this acts as the axis. Like the midline of your body is your body's axis, this is the axis of your foot. Any movement towards the axis is called as adduction. Away from the axis is called as abduction. Simple. Okay, remember this principle because you will come across it in this lecture as well as the next one. Okay, it's important, it's relevant. Right. So, one last time, names of tarsals. Proximal row, talus calcaneus. The next distal row, navicular cuboid. Beyond that, medial, intermediate and lateral cuneiform. These are all my tarsals. So now, let's see these bones on this articulated foot. Okay, so all the bones have been put together with the help of a steel wire, as you can see. And let's understand these bones. So most proximally calcaneus, sitting on top of calcaneus, the talus. See this one. In front of both of these two are the navicular medially and the cuboid laterally. Calcaneus, talus, navicular, cuboid, and these three here over which I am putting my finger, medial, intermediate and lateral. Medial, intermediate and lateral cuneiforms. In front of it, these are the metatarsals and these are the phalanges. Just remember 2 phalanges for the first toe and 3 phalanges for all the others. So these are all the bones that come together to form your articulated foot. Okay, now what do? We begin to study them individually. First, we will be studying this bone, which is our talus. Students, let's now study the tarsal bones. Okay, so the first bone we'll be studying is the talus. So, if it looks like a tortoise, then it must be a tortoise? No. If it looks like a tortoise, then in osteology, it's likely to be this sweet little bone, the talus. So this is the sweet little bone, the talus. It has a head, a neck, a shell just like the tortoise. Okay. It has a medial comma-shaped facet for the medial malleolus of tibia. It has a lateral triangular facet for the lateral malleolus of fibula. Okay. So anteriorly head and neck, superiorly the trochlear surface, the shell of the tortoise, medially comma-shaped facet, medial malleolus of tibia, laterally triangular facet articulates with lateral malleolus of fibula. Inferiorly it shows 2 articular facets. You can see how one is distal. This is called anterior and middle articular facets. Posterior one is really large, the posterior articular facet, in between separated by the sinus tarsi. Take a good look because we're going to see and discuss all of this on the screen later. Let's turn this bone over. Now you're looking at it from posteriorly. Can you see that there are 2 tubercles here and there is a groove in between? A medial tubercle and a lateral tubercle and a groove in between. Okay, have you understood? So this beautiful bone is your talus. Let's begin to understand a little bit more of it on the screen. Come. So here is our tortoise or the talus. Okay, as viewed from above, tubercles posteriorly, you just saw that. This is the head and this is the narrow neck. The head, neck and posteriorly you find that beautiful trochlear, the shell of the tortoise, which is the body of talus. Right. The head is rounded, okay, and it articulates with the navicular bone. The trochlear surface superiorly is going to articulate with the tibia and fibula, also called as tibio-fibular mortis, which comes and fits on top of this, forming your ankle joint. Okay, take a look at this image now. You can see that this is tibia, this is fibula. Orient yourself, okay? And then here is your talus in the middle. See how the tibia and fibula are together creating a mortis into which the talus comes and fits from below. So this, my dear friends, is your talus in the articulated foot. Okay, so this is the beautiful trochlear surface over which the tibia and the fibula are going to fit. This is the triangular facet for the lateral malleolus of fibula. This is the comma-shaped facet for the medial malleolus of tibia. So now imagine, this is the tibia. I've already made sure they're all of the same side. I'm going to make the medial malleolus articulate here. Okay. And I'm going to make the fibula come and articulate here. And do you now see formation of an ankle joint here? This is how you walk. Dorsiflexion, plantar flexion, dorsiflexion, plantar flexion. Who is the single bone articulating with tibia fibula to form ankle joint? It is talus. Talus is acting like a link between the tibia and fibula above and the rest of the bones of foot below. Okay, if you've got this, then the rest of the discussion on talus will not be difficult for you. Come. So here you can see the tibia, fibula, talus, and you can see how tibia and talus are articulating. Medial malleolus and talus are articulating with the comma-shaped facet. The fibula is articulating the lateral malleolus, articulating with talus at the triangular facet, thus forming the ankle joint. So this is the rounded head which will articulate with the navicular bone. This is the trochlear surface, comma-shaped facet on the medial malleolus, triangular facet on the lateral malleolus, all together forming the ankle joint like I just showed you. And now we've turned the talus over and we can see on the inferior surface a facet for navicular, anterior and middle calcaneal facets to articulate with the calcaneus bone. And here is the groove called the sinus tarsi, and here is the posterior calcaneal articular facet. I'm going to show you this again, okay? This is the inferior surface of talus. You can see that there is an articular surface anteriorly, then there is a groove here and an articular surface posteriorly. The anterior surfaces are anterior and middle. Posterior is this posterior, separated by a groove called the sinus tarsi. So there are two types of joints you find formed in the inferior surface of talus. Come, I'll show you what's going on. So here is your calcaneus, here is your talus. Take a good look at this, okay? Here are the anterior and middle calcaneal facets that I just showed you. Similarly, anterior and middle facets are found on the calcaneus as well, and these articulate. I'm going to show you this, wait. Similarly, this big surface is the posterior calcaneal articular surface, which fits on the posterior articular surface on calcaneus, and together they articulate. Okay, so if you have a calcaneus with you, pick up the calcaneus as well. Here's my calcaneus, okay, and I'm just going to take my talus, okay. This is the anterior and middle facets on calcaneus, posterior facet on calcaneus. I'm going to just drop my talus on the top. And that's how they articulate. You can't make them articulate, it's difficult. Just hold your calcaneus correctly and just drop your talus on the top and they will automatically articulate with each other. Okay, this is the joint formed between the talus and the calcaneus. One set of joints anteriorly, one set of joints posteriorly. Okay, there are two sets of joints being formed here. We will discuss them a little bit more. First, learn to articulate these two like this. Okay, come. So now we are looking at this from the medial side. This is the rounded head of talus, which is articulating with the navicular bone anteriorly. Calcaneus, sustentaculum tali posteriorly. And the two are joined together by a ligament called the spring ligament. I want to show you this. Take a look. This is the beautiful rounded head of talus. Here's your navicular. Here's your calcaneus part called sustentaculum tali. So the head of talus is articulating with navicular and with the sustentaculum tali, and in between there is a gap. Can you see the gap here? And in between that gap is breached by a ligament called as the spring ligament or Talocalcaneonavicular ligament. Very important, you have to know it. Just observe the way my index finger is connecting the two, connecting the navicular to the sustentaculum tali. That is your spring ligament. Come, that's the Talocalcaneonavicular or the spring ligament. The joint formed is therefore called Talocalcaneonavicular joint. Talo is talus, calcaneo is the sustentaculum tali part of calcaneus, and navicular is of course the navicular bone. But the posterior joint that is formed between the posterior articular surface of calcaneus and the posterior articular surface of the talus, this posterior joint, okay, this is called as the subtalar joint. What is it called? Subtalar joint. Sub is below the talus, subtalar joint. Okay, so one last time on the articulated foot, please. Okay, Talocalcaneonavicular joint here. Talocalcaneonavicular joint formed here, and subtalar joint formed here posteriorly between the talus and the calcaneus. Two sets of separate joints separated by a groove called sinus tarsi. Right. So, now come to the posterior part of talus. If you recall, I had shown you there were tubercles there. Okay. So, posterior tubercle of talus has two parts. A medial tubercle here and a lateral tubercle here, separated in the middle by a groove for the flexor hallucis longus tendon. Now, why are we discussing this? A, you should know this. B, you should know that the lateral tubercle of talus sometimes does not fuse only with the talus. It becomes a separate bone. Okay? In which case, can you imagine that on X-ray, it will look like a fracture. But is it a fracture? No. It's just a bit of bone has not fused with the rest of it. This bit of bone is called as the os trigonum. Os trigonum. It is an example of atavistic epiphysis. You remember we've done the coracoid process of scapula, example of atavistic epiphysis. Bones that go and fuse with other bones for better nourishment. Os trigonum is one of those. Can be mistaken for a fracture on X-ray. Right. So what is the peculiarity of talus? It is peculiar in that it has no muscle attachment. See, we had such a lovely time discussing this bone. Did I ever tell you that there is a muscle attached to it? No, it has no muscle attachments. Okay, it's one of those bones. But it has a lot of ligaments attached to it. Of course, part of the ankle joint, it will be supported by ligaments. So which ligaments? See here, this is the deltoid ligament, which has a superficial part and a deep part. Superficial part extending from the tip of the medial malleolus of tibia down to the navicular, down to the sustentaculum tali, down to the medial tubercle of talus. If you go deeper to this, there is one part that goes to the medial surface of talus. That's the deep part. All these parts together form a very important ligament of your ankle joint called the deltoid ligament, superficial and deep. Right. So these are a set of questions I would love you to answer. I think you should be able to answer them. There's nothing here which I have not already taught. However, if you don't know the answers, feel free to ask me in the comment section. Right. Now you can see that this is the talus being supplied by an artery here, which is supplying one part, the head, and then going distally to supply the body. Again from above, one artery supplying the head and going distally to supply the body of talus. These are the two arteries and this is their supply. Now imagine if there is a fracture, the supply to the body of talus is cut off. So what happens? The talus typically is a bone that enters into non-union. Okay? Talus fractures can occur due to high energy trauma during sports, and these bones typically, and this bone typically enters into necrosis because the blood supply comes from the head backwards. Okay, so from the head backwards, you have a fracture here. The blood supply to the rest of the talus itself is lost, resulting in necrosis of the talus. The reason for this necrosis is a very complex blood supply and of course a very important absence of any muscle attachments. Wherever there is a muscle attached to a bone, with the muscle comes the blood supply. So if there is no muscle attachment, it is as it is, having comparatively lesser blood supply. Okay? Right. So with this we finish our wonderful tortoise or the talus. Let's go to the next bone, which is the calcaneus. Again, you are advised, take the calcaneus in your hand, feel the bone. Okay, understand it. It's shaped in a different manner. It has something projecting out from it. Feel the bone. Okay, and then let's begin to discuss the calcaneus, the largest tarsal bone. situated below and behind the talus. We've already seen that it gets situated below the talus, subtalar in position. So here's your calcaneus, here's your talus. Okay, the calcaneus is to be held in such a way that the anterior end of the calcaneus is directed forwards, upwards and laterally. See, you can see that the calcaneus is not horizontal. You are not supposed to keep the calcaneus like this. You should not rest the calcaneus on a horizontal surface. It should be resting like this. The anterior end of the calcaneus should be directed upwards, forwards and laterally. Do that. Unless you have bones in your hand, you're not going to remember it. Tell me, why should my calcaneus not be resting on the ground flat? Because I've got an arch. The feet are basically arched. We've got a medial arch of foot, we've got a lateral arch of foot. If the calcaneus decides to rest flat on the ground, we will never have an arch, isn't it? So, because there is an arch, you will hold the calcaneus with the anterior end facing upwards, forwards and laterally. And then holding it like this, you will rest the talus on it gently. See how beautifully the talus stays? It doesn't try to fit in, it just goes and sits, right? Okay. So, anterior end of calcaneus is here. Here. It articulates with the cuboid bone. Both the surfaces are concavo-convex. What does concavo-convex make you think of? Which joints have got concavo-convex surfaces articulating together? Yes, saddle joints. So, calcaneocuboid is a typical saddle joint. Now, question is, name two other saddle joints of the body. I'm sure you're going to be able to do that. First, I'm going to ask you, why am I doing this? Yes, because first carpometacarpal is a saddle type of joint. Another is your clavicle and sternum. Sternoclavicular joint is a saddle type of joint. Very, very commonly asked questions. So we should always keep on revising. There's no point in just studying something in isolation. Right. So the calcaneus, as you can see, forms a part of the lateral longitudinal arch of foot. Here's the anterior end of calcaneus. Here's the cuboid. You can see how a bit of cuboid is projecting backwards and the calcaneus is resting on it. That's the point. This projection is called the calcaneal angle of cuboid. The calcaneus actually rests on it, helping to form the lateral arch of foot. So, you can see that we saw a Talocalcaneonavicular joint and now we are seeing a calcaneocuboid joint. Talocalcaneonavicular joint, calcaneocuboid joint. Both these joints are formed between the two proximal bones, the talus and the calcaneus, and the next set of bones, the navicular and the cuboid. These are therefore called as metatarsal joints, joints formed in the middle of tarsals, mid-tarsal joints. Okay, so name the two mid-tarsal joints: Talocalcaneonavicular, calcaneocuboid. The posterior end of calcaneus receives the wonderful tendon, your favorite tendon, tendo-calcaneus or Achilles tendon. Okay, so that comes and gets attached here along with the tendon of plantaris. Okay, so you can see that happening here. This is the posterior end. And here you can see the beautiful tendo-calcaneus getting inserted into the posterior end of calcaneus. For those of you who do not know, what is the story of Achilles tendon? I've put up a video of this in case you want to watch, please do. Otherwise, you should know that this is a beautiful, touching story of a loving mother who decided to protect her baby by dipping the baby in the holy water. You can see her doing that. But when she was dipping the baby in the holy water, she held him by the heel, because of which the heel remained unprotected. The baby grew up to become the famous Achilles, the warrior who could never be killed. But because his heels were weak, when he got hit by an arrow in the heel, finally Achilles died. So even the strongest of us have some weakness. and that weakness is called as our Achilles heel. It's a beautiful story. Do enjoy it. Anatomy comes up with these sweet tales, and suddenly the world looks brighter for an anatomy student. Okay, so, and you can of course read more about this. It's quite a lovely tale. Turning the calcaneus over, on the inferior surface of calcaneus, you find 3 tubercles, anterior and 2 posterior. The posterior, of course, can be medial and lateral. So, 3 tubercles on the inferior surface of calcaneus. Anterior tubercle, lateral and the medial. Right? Okay. So, you see this medial tubercle? Okay. Every time you walk, it is this tubercle that strikes the ground. It's funny, but it's a medial tubercle that strikes the ground every time you walk. Okay. So, remember the medial tubercle. Continuing, these tubercles give attachment to 2 very important ligaments of your foot, the long plantar and the short plantar. Take a look. Extending from the anterior surface of the calcaneus to the adjacent surface of cuboid is your short plantar ligament. Extending from all the 3 tubercles to the basis of the metatarsals is your long plantar ligament. Basically, holding the bones of your foot together are the short plantar and the long plantar ligaments. Please use these images. Sometimes I can go on describing, but the images will speak better than I do. Okay, I'm glad of it because images will remain with you. Okay, so use these images well. Right, so the superior surface of calcaneus, like I showed you, has 2 anterior facets, the anterior and the middle articular facets, for formation of the Talocalcaneonavicular joint. 1 posterior facet for formation of the subtalar joint. It shows a medial projection as seen here called the sustentaculum tali. Wait, take a look at it. Okay. If you're looking at the surface of calcaneus from medial side, you can see this little projection here. It's a shelf-like projection from calcaneus called the sustentaculum tali. Look at it here in the articulated bone. Look at it here in the individual bone. Can you see this shelf-like projection medially? This is called the sustentaculum tali. Okay, so in fact it helps you to side identify the calcaneus. Okay, anterior end for the cuboid, sustentaculum tali medially, facet for articulation with the talus superiorly, 3 tubercles inferiorly. Very simply, this has to be the calcaneus of the left side. It's very easy. Okay, so this is the sustentaculum tali I'm going to be talking about for the next 1 minute. This gives attachment to deltoid ligament, we just saw that, and to the spring ligament of plantar calcaneonavicular ligament. So take a look at this image. This is your sustentaculum tali, giving attachment to deltoid ligament from above and plantar talocalcaneonavicular ligament from below. These are the attachments to your sustentaculum tali. It's also related to some muscles. See, what happens is the muscles from the leg descend down, go and pass below this to enter into the foot. So it is inferiorly related to 2 muscles, flexor digitorum longus, flexor hallucis longus. Flexor digitorum longus, flexor hallucis longus. Both are muscles of the posterior compartment of your leg. Right, so you can now come to the lateral surface of calcaneus, this surface here, okay. You can see that it shows a little tubercle here. Note that tubercle. This is the calcaneus. Here is the tubercle of peroneal trochlea, above which passes the tendon of peroneus brevis, below which passes the tendon of peroneus longus. Okay, as both these tendons will go into the foot, brevis getting attached to the lateral end of the 5th metatarsal, longus continuing further in its journey. There is a posterior tubercle as well, don't bother to learn about it. So here's your lateral surface of calcaneus, here's your peroneal trochlea, you can see 2 grooves above and below it. Okay, now let's come to something very interesting. Okay, maybe you should pick up a cup of coffee or something. Remember, all this is to be done only relaxing comfortably. So now you can see that there is something happening here to the calcaneus. This is a very common condition called the calcaneal spur. A part of the calcaneus begins to grow down like a spicule, bony spicule. So this kind of projection is called as the heel spur. And this is a site for severe pain for patients as they grow older, okay, and resulting in plantar fasciitis, sometimes even Achilles tendinitis. There are some people who also have a bony spicule growing upwards here, which results in Achilles tendinitis. Okay, so heel spurs are very commonly associated with calcaneus bone. So some questions again for you. Identify the calcaneus, hold the calcaneus in its normal anatomical position, articulate it with the talus. We've covered all this. Let's now run through the rest of the tarsals at a good pace, because there's only X amount of information you should know about the rest of them. So let's talk about the navicular. How will I identify it? A bone with a cup. Come. So here I have a lot of little bones. I know they're all tarsals. Okay, but how do I know which one? So what I do is, I pick up the one which has this kind of a beautiful cup-shaped articular facet on it. Close your eyes and just call it the navicular. That's how you identify the navicular. A bone with this kind of a facet on it. Obviously for articulation with the talus bone. Okay, so that's the navicular. Here you can see this is the navicular, proximally articulating with talus, laterally with the cuboid, distally with the 3 cuneiform bones. Navicular on the medial side shows presence of a beautiful tuberosity. This is the tuberosity where there is attachment of the tibialis posterior muscle majorly. Of course, it's attached to a lot of other bones, but majorly to the navicular tuberosity. So you can see the navicular tuberosity also receiving the attachment to plantar calcaneonavicular ligament, extending from sustentaculum tali to the navicular bone. So that's navicular. Now, this is what I have left. A lot of bones. Okay. So now which one is my cuboid? I'm going to pick up a bone which shows a groove inferiorly, which shows a concavo-convex facet proximally. Concavo-convex. Which joint am I talking about? Obviously calcaneocuboid, which is a type of saddle joint. Right? So here take a look. This is cuboid. Proximally articulating with calcaneus, calcaneocuboid joint, medially articulating with the navicular and the lateral cuneiform, distally articulating with the 4th and 5th metatarsal. It's very easy actually. Just take a look at it and it's all obvious. This is your cuboid, distally with these 2 metatarsals, medially with the lateral cuneiform and with the navicular, proximally with the calcaneus. Easy enough. So this is something very important. It's quite beautiful actually. That's the cuboid, and can you see that on its inferior surface there is a beautiful little groove? That groove is for the tendon of peroneus longus enclosed in a synovial sheath. See how the peroneus longus tendon passes across the foot inferiorly to get attached to the medial surface of the first metatarsal proximally and to the medial cuneiform. Okay, so literally the tendon passes like this across, just like my finger. So it actually helps to hold up the arch of the foot. Okay, imagine that the tendon is coming from above, passing through this groove across the foot to come and get attached like this. Okay, so that's the peroneus longus related to the groove on the inferior surface of cuboid. Right. What about the cuneiforms? Yes, there are 3 cuneiforms: medial, intermediate and lateral cuneiforms. Proximally articulating with navicular, distally with first, second, third metatarsal bones, laterally with the cuboid. Again, self-explanatory, you needn't have me teaching you this basics. But there's something very interesting happening here. This is medial cuneiform. This is intermediate, see it's red. And this is lateral cuneiform. If you look carefully, medial articulates with first. Lateral articulates with third. But the intermediate cuneiform is small, and because of which there is a little cup-shaped depression into which the second comes and fits. So that, look carefully how the second metatarsal is kind of fixed between these three cuneiforms. You can't really move the second metatarsal much. You can move this, you can move this. This one is fixed, and it is for this reason that the axis of your foot passes through the second toe. Try in your own foot. Try to move your second toe. It's very difficult. The other toes may move. Middle is a little bit more difficult than the rest. Okay, so that's why the axis of your foot passes through the intermediate cuneiform and the second metatarsal bone. Right. So here's your medial cuneiform and the first metatarsal. Note, coming from lateral side, these two bones give insertion to the peroneus longus. Coming from medial side, these two bones give attachment to the tibialis anterior. And just imagine, beautifully between the two of them, they actually hold up the arch of the foot like this. Okay? Try that on the articulated foot you have in your hand. You will never forget why you have an arch in your foot. These two muscles crucially help to hold up the arch. Right. What about metatarsals and phalanges? Frankly, you needn't know much about them except the very basics. So what should you know? This is the first metatarsal. This is the first metatarsal, the thickest of the metatarsals. I'm sure you can identify it. These are the second to fifth metatarsal bones. The first is shortest and the strongest. Second is the longest. Obviously, it is longest because it's so articulating so proximally. The fifth has a bony projection for the attachment of peroneus brevis on it. And now we can take a look at the differences between metacarpals and metatarsals. We've done this when we did upper extremity bones. We're going to do this again when we do lower extremity bones. So this is your metatarsal. And this, my dear friends, is your metacarpal. Keep this in front of you and begin to compare. Okay, see how they're different, completely different, because their functions are different, isn't it? So, this is the dorsal surface of my foot. This is the dorsal surface of my articulated hand. And let's compare. The head of the metatarsal is quite narrow. Okay, the head of a metacarpal is very wide. Forms your knuckle, isn't it? It's quite wide. The shaft of a metatarsal shows concavity on the plantar surface. On the lower surface, it shows concavity. But in the hand, the concavity is on the palmar surface. Okay, you will find the concavity over here. The width is such that the metatarsal tapers from above downwards. In case of the hand, the metatarsal widens out distally. It's quite narrow proximally, widens out distally to form the knuckle. The dorsal surface in case of metatarsal does not show any facet. But in case of metacarpals, can you see it shows this beautiful triangular facet? Yes? So, last, you will number the bones of the hand from lateral to medial side. First, second, third, fourth, fifth, isn't it? But in case of the foot, you're going to number the metatarsals from medial to lateral. First, second, third, fourth, fifth. Cool? Okay. So I have asked you a lot of questions. I've given you the answers as well. Otherwise, the answers to all are always found in the notes section. Please feel free to access that. So That completes my lecture on bones of foot. We will now be moving on to muscles attached to these bones of foot. So that's the next lecture. First, go through this again, revise, understand the bones of foot, and then we will discuss the muscles that are attached to this. Okay, the muscles that help to convert this articulated foot into a functional unit. Okay, so I'll see you in my next lecture. Bye.